Good day everyone. So today we are going to discuss on how to perform the different procedures in proper hand hygiene. So what is the rationale? Why do we have to do hand washing or hand hygiene? This is to prevent the transmission of microorganisms from one. Good day everyone. So today we are going to discuss on how to perform the different procedures in proper hand hygiene. So what is the rationale? Why do we have to do hand washing or hand hygiene? This is to prevent the transmission of microorganisms from one person to another. So according to World Health Organization, we are going to perform hand hygiene first, before and after patient contact. The second, before and after performing a certain procedure. Third, before putting your gloves and after removing your gloves. So this is one of the most effective way to break the link of chain of infection. So according to World Health Organization, when your hands are visibly soiled, you are going to perform hand hygiene using an antimicrobial soap and water. But if your hands are not visibly soiled or contaminated with, for example, body substances, body fluids, blood, feces, urine, etc., the recommended way of performing hand hygiene is just by using an alcohol-based solution. So, what are the materials that are going to be used in this procedure? So first is the antimicrobial soap. The second is water. And of course, the tissue, paper, or the towels. Okay? So today, we are just performing the medical hand washing. Okay, so now let us ready to perform our hand washing procedure. So first is the assessment. Okay, so inspect first the surface of our hands for presence of breaks or cuts in skin or cuticles or presence of lesions, and then inspect the hands for visible soiling. Inspect the condition of the nails. Okay, ensure that your nails are short and smooth. Why? Because long nails can be a medium of contamination for microorganisms. Okay, so let us remove any jewelries. So I have a ring, so let's remove our ring. And then if you have wristwatch or if you have long uniform sleeves, you will raise it above your wrist. Okay, so now we will no longer perform the antiseptic hand rub. So let us focus on medical hand washing using regular or antimicrobial hand soap. So you will now stand in front of the sink, keeping hands and uniform away from the sink surface kasi yung sink might be a reservoir for microorganisms, so pwedeng maging transfer yun for infection. Okay? And then after that is you will turn on the water. Okay? And then avoid splashing water against your uniform. And then you will regulate the flow of water. So make sure okay po ang kanyang flow of gravity. And then kung meron yung mga sink na merong adjustable na warm water, cold water, pwede pong gamitin. Pero kung wala, it's okay. So next is, we will now wet our hands and wrists. Make sure lang po na yung ating hands and fingers is below our elbow. Kasi di ba kapag sa clean technique po, our hands and fingers is considered as more contaminated than our elbows. So make sure po na, syempre, by the principle of gravity, make sure na mas mababa po yung hands and fingers natin kesa sa ating elbow. So after wetting our hands, we will now apply appropriate amount of antiseptic soap. And then, make sure na i-rub natin ito in our hands together. So, we will wash our hands properly for at least 15 to 20 seconds keeping our fingertips down. So, isusundin po natin yung procedure ng World Health Organization sa hand washing procedure. So, first is rub the hands palm to palm in a circular motion. And the next, so the second step is right palm over the left dorsum, okay, with interlaced fingers. And then vice versa. And then next is palm to palm with fingers interlaced. Palm to palm. And then the fifth procedure is back of the fingers to opposing palms with fingers interlocked. And then vice versa. And then next is rotation rubbing of left thumb clasped in right palm. Okay. And then vice versa. And then after that is make sure that our fingernails are clean. So rotational rubbing backwards and forwards with clasped fingers of right hand in left palm. And then vice versa. Okay? Kung meron po tayong disposable nail cleaner, pwede po natin gamitin. Pero kung wala, make sure that our fingernails are clean. So after that, we will now rinse hands and wrists, keeping still our fingers and hands down, elbows up. Okay? So, hindi pa po natin ito turn off yung faucet. So, next is, kunin natin yung ating paper towel. And then we will dry our hands using the paper towel. Then after that, discard the paper towel in the proper receptacle. And then, using clean, dry paper towel, we will now turn off the faucet. Okay, meron po tayong mga sink na ang ginagamit nila is foot or knee pedals. So kung ganun po ang gamit, mas maganda. Okay, so now, apply appropriate lotion to hands, but that is optional. So, we are done with the performing of the proper hand washing procedure. Thank you very much, and I hope that you have learned something in this video. For questions and concerns or queries, please post it in our Google Classroom. Goodbye!